Konnichiwa, Dr. Braces here. Thank you so much for tuning in. Today is part 2 of our reaction to sports injuries. So enjoy, and I will let you know kind of like what I think, how these injuries should be treated. So first one, let's go right here. Reminder, I have not seen these yet. Oh, should I not turn the sound on?
No, yeah, keep the sound on. It's fine.
Got him in the face.
Oh my gosh.
The ball just got off me so quick.
Oh, broken nose.
Before I knew it, I was on the ground.
Oh!
A couple inches to the right or left, it's my eye. And who knows
Broken
what
nose.
happens there.
That would have ended Pilar's career. Instead, the Mets outfielder with a tough guy reputation looks more like a beat-up boxer. A couple of broken bones in his nose and 2 black eyes.
Broken nose, yeah, 2 black eyes. When I broke my nose, I got 2 black eyes too. And I broke my nose the same way with a baseball, which I think I talked about that in the last video. So here's what's going to happen with his broken nose. You can see in his press conference interview, his nose is like this. So he's probably he's going to need that to get that reset, meaning like they're going to take that bone, reposition it into the right spot, and then let it heal. And I think it's like a 3 to 4 week healing time. I'm not positive on that. Important thing on getting that nose deviated back to where it's supposed to be is just being able to breathe, because if the nose is too crooked, the airway's kind of closed off a little bit. You can't breathe through your nose as well. So that's a nasty one though. That hurts. Mine was not that bad. All right, let's see here. Next one. Oh, geez, keep her right to the face. Is he going to go down? Oh, man. All right, so soccer ball to the head. Yes, I have had that injury too. He probably has a concussion. So when I got my concussion, I went up for a header. Guy clipped my legs, and then I fell on my head. And so I remember going to the ref and being like, "Ref, I don't know where I am." And he's like, "No, you're okay." I'm like, "No, really, like, I don't know what day it is. I don't know where I am. I got to sub off." And he's like, "Okay." And so then he called my coach out so I could go off. But yeah, concussion, the main thing. I think you'd have to double check this, but just you don't want to let them go to sleep, right? Keep them awake for a number of hours. And yeah, just make sure they're, either going to have to go into like a concussion protocol. It might be pain to bright lights and things like that, headaches, migraines, stuff like that. So you want to keep them out of contact sports, out of activity, out of running and everything until concussion symptoms totally go away. If it's a minor concussion, sometimes it's just a number of days. Sometimes it's the next day, they're fine. If it's a big concussion, sometimes it takes weeks, even months. So it's important though that you don't get reconcussed, because that's where worse things can happen. So, alrighty. Next one. We got rugby. Ooh, elbow. All right, so elbow to the face, it looked like right around the eye. The main thing that they'd want to do in that situation is get an x-ray, make sure the orbit bone isn't fractured. The orbit bone is the one that's right around your eye here. Elbow to the face, a lot of the times you're going to get a black eye for sure. If you get elbowed in the eye. But again, you want to make sure that orbit bone's not fractured and that there's not any potential harm to the eyeball itself that can happen. If there's a fractured bone, again, it can cause damage to your eye itself, and that's something you want to totally avoid. So that's definitely an ER visit for that one, would be my recommendation. Okay, next one, another baseball. Oh, right. And he caught it. Oh my gosh, he freaking got it.
It got him. It hit him.
He caught it and his jaws broke. That is rough. I don't know. I think we talked about a broken jaw in the last one. If it's an upper jaw, it's funny kind of how we figured this out. The upper jaw tends to break in 3 different ways. They call it a Le Fort 1, Le Fort 2, or Le Fort 3 fracture. And so Le Fort was a guy who lived in a time where, I think it was like the plague or something. Don't fact check me on this, but so there was just like bodies everywhere. And so he would go out at night, because this was illegal. He would gather up bodies, right? And he would go up to the top of a high building and he would just chuck the heads off the building. And then he would see how the jaws fractured. when they impacted the ground. That could be an urban myth, but that's how it was explained to me, how we know what a Le Fort 1, Le Fort 2, and Le Fort 3 fracture is. And so the reason why I know about Le Fort fractures, though, is when orthodontically, let's say someone has a severe underbite and we have to do jaw surgery to bring the top jaw forward. That's what you're always talking about. Are we going to do a Le Fort 1, Le Fort 2, or Le Fort 3? And that's a controlled fracture. But
Who told you that urban legend about that guy?
they talked about that in dental school and in ortho school, actually. So when I was in ortho school, so you have to know, if you're doing surgical cases, you have to know how the surgeries work, right? And so so I was lucky enough when I was in the Air Force, I got to sit in on a number of orthognathic surgery cases where they were correcting the jaw position. But yeah, the surgeon that came to my ortho school and taught us, there was an oral surgeon that came and lectured once a week and gave us, this is how the surgeries work type conversations. That's where we learned about Le Fort fractures. And so that's what he said, is that, and again, it may not be an urban legend. I have never looked it up. So I'm sure it's true. Like, I don't think the surgeon would make this up. They probably teach it in surgery schools, but that's kind of how we figured out the way that jaws fracture is. Le Fort went up and chucked skulls off of rooftops and went down and gathered them and saw where the fractures happened on the actual bone. And so that's why there's 3 different Le Fort fractures. Quick internet search teaches us that Le Fort fractures were discovered by French surgeon Rene Le Fort in 1901 through experiments on cadaver heads, where he applied blunt force using clubs, rods, and other methods, again, probably going to the top of buildings and chucking them off, to identify predictable patterns of mid-face weaknesses, classifying them into 3 types, 1, 2, and 3. 3, I knew it, based on fracture lines through the lines of least resistance in the skull. His work established a crucial system for understanding and treating mid-face trauma, though modern high-energy injuries often present more complex patterns. Interesting. And I believe all this work, again, the way it was taught to me was like in 1901, this kind of stuff on cadavers was illegal. So I believe everything he was doing, he was doing it in the name of science.
Please, it's for science.
Well, for science, in that case, proceed.
But he was kind of doing it at risk and breaking the law to be able to learn and discover these things. So shout out to Rene Le Fort, for, pushing the boundaries and making these significant medical discoveries. Sure, but yeah, that could be, if it's a lower jaw, usually the fracture happens somewhere here along the ramus. And then I think we talked about that too, but you can't open or close as evenly, and big problems there. So a lot of the times to treat a fractured jaw, you have to wire that jaw and fixate it, plate it. And so soft foods, maybe liquid diet for a while, soft foods, and then let that thing heal. Hopefully it's not too bad where the surgeon has to put them back together. I treated a friend, and I may have talked about this in the last video, where he took a softball to the face and it fractured his jaw right here. Just like that, right where the softball, like you can see the shape of the softball in his jaw. So we just had to hold his teeth together, plate his jaw, and just give it time to heal, basically. So yeah, not much you can do for those except wait it out. All right, I think we got one more here.
Wait.
Sorry. Yeah.
I have a question.
Sure.
Why, do you know, why is it that if you're boxing and you get hit in the jaw, that knocks you out?
That's more of a symptom of you got hit so hard, right, that the brain rattled in your head, right? The brain got, shaken, disturbed to the point where, yeah, you get knocked out. Yeah. So even though you get hit here, it's still a blow to the head. You get hit, and the force of that causes the brain to just you know what I mean?
Yeah.
And so, yeah.
Like, why is it in the jaw and not like the eye? You get hit in the eye and not knock out. But
I think you probably get hit anywhere and get knocked out as long as it's hard enough. So, yeah.
I'm pretty sure there's like a certain spot in the jaw, like it's like right on the jaw.
Mm-hmm. I honestly, I don't know the answer to that. So
okay.
we'll have to do a Google search on that one. So, yeah, luckily I've never got in a fight where I got hit that hard. So, so I've lost plenty of fights, but yeah, not to the point where I got my brain rattled. So, what's crazy about boxing is people do that voluntarily. So those are braver folks than I am. All right, so let's see here. Last one. I think this is just a picture. Oh, dude, he took a cleat to the face. That's almost like a puncture wound. So I can't tell. Let me zoom in on it here a little bit. Yeah, it looks like there's like grass in there. Oh, gross. He's just going to have to go get that cleaned out. It doesn't look like it's a laceration where it needs to get stitches. So another one, yeah, you're just going to kind of give it time, let it heal. There'll probably be some scarring there, but not much you can do for it in terms of preventing scarring and things like that. He'll probably have that guy's cleats on his face, though, for the rest of his life. So, yeah, sports are dangerous. They're fun, but, man, competitive sports can be nasty. They can cause some serious injuries, trauma to the head, to the neck. The best way to prevent serious problems is a mouth guard, right? If you're playing any kind of contact sport, I always recommend a mouth guard, because if you don't, that can totally prevent your teeth from getting knocked out. And so that's why it's a good thing to have. Even if you think like it would never happen in the sport that I play, trust me, it's happened in the sport that you play. So everyone's gotten teeth knocked out in every sport, I promise. So.
Even like tennis?
Okay, maybe not tennis, right? Maybe not like golf, right? Actually, true story. I do know of multiple trauma cases from golf to the face. And it's not on the ball, it's on the backswing. So it's like someone's taking a backswing and there's a person, like it's at a driving range, and you'll have to have that line that's like, don't cross this line. Well, someone goes on the wrong side of that line right as someone's taking a backswing. Boom, golf club to the face, broken jaw. I've seen it happen a few times, actually. So yeah, like I said, I don't think you need to wear a mouth guard with golf, but just don't pass that line at the driving range. You know what I mean? Follow the rules. They're there for a reason. So especially like places like Topgolf and stuff like that. Like my son, he loves Topgolf. He wants to go there for his birthday every year. And so I take him and 4 or 5 of his buddies, and I'm always watching to make sure no one's getting too close, because they get excited like when something cool happens and they want to like go up there, and I'm like, no, stay back, like he's getting ready to swing. So I've just seen it happen too many times. Broken jaw, I've seen it at least 3 times actually. So but tennis may be okay. I mean, again, there's probably someone who's lost teeth playing tennis at some point in time. It's probably not documented, but even if you went for a ball, you tripped, you fell on your face, right? Boom, knocked your front teeth. So I still don't know that you need a mouth guard for tennis, but I'm just saying I would almost say with how many people play tennis in the world, it's probably happened at some point. So, all right.
All right. With that, can you rank top 5 most dangerous for your mouth sports, and then your 5 safest?
Oh, number 1's hockey for sure, because hockey players don't usually wear mouth guards, and the professionals at least don't wear a face shield. So they're taking pucks to the face all the time. So, and that's why when when hockey players smile, they're missing teeth a lot of the time. So yeah, number 1, hockey. Number 2, probably baseball, right? Just based on everything that we've seen here. I'd say hockey and baseball most dangerous for your teeth and for your mouth. From there, again, like when mixed martial arts, boxing, you honestly don't see a lot of mouth or teeth injuries. Fractured jaws, yes, but lost teeth, no, because it's in a rule that they have to wear a mouthpiece to do it. So in terms of teeth itself, you don't see a lot of lost teeth from those kind of like combat sports. Yeah, combat sports, because a rule, you can't get in the ring if you wear it. And even if you watch a boxing match or MMA, if the mouthpiece falls out, the ref stops the fight immediately. Like, it stops, right? They're not allowed to keep going when someone loses their mouthpiece. So you don't see a lot with MMA and boxing, which is kind of interesting. But yeah, probably the most that I see for sure. Nevada, we're in the desert. Hockey's getting bigger because of the Golden Knights, but I see the most trauma from baseball. Baseball. And then the other one I've seen a lot of is kids that go to the skate park. So like skate park on their bike, on their scooters or whatever. You hit a ramp or hit a jump or whatever, and you just lose balance, crash on your face. And yeah, I've done a lot of repairs and trauma from skate parks. So I'd say mouth guard at skate parks for sure, especially if you're going big or going home. So because sometimes you go big and that makes you have to go home because you banged your face on the concrete. So those would be we'll go top 3. I'd say actually, you know what? Let's put basketball in the 4th category. I've seen a lot of of trauma from basketball, not in youth basketball as much, but adults playing like pickup games, right? Because I don't know, people always try to prove their worth in adult leagues and throw elbows and stuff. So you take an elbow to the face, boom, tooth gets knocked out. You see that quite a bit with basketball. But so that would be my top 4: hockey, baseball, skate park, basketball. Probably skate park and basketball are about even though. So the good news is like the NBA players, LeBron, Steph, they're all wearing mouth guards now. Steph has his hanging out most of the time, especially when he's shooting free throws. But when it's live action, he's got it in, you know. And so hopefully that's at least teaching the kids like, yeah, it's okay to wear a mouth guard when you're playing basketball. So absolutely. But I would definitely recommend mouth guard for hockey. And I know in youth hockey, they have to wear them. That's a rule. I know in youth football here in Vegas, you have to wear them. That's a rule. Yeah, hockey. Yeah, if you're pitching for baseball, probably, yeah. Now a lot of the helmets have those side shields. And so usually you're probably okay at baseball. The odds of getting hit right where you're going to lose teeth is probably pretty low at this point with the side shields on the helmets. But as you saw in the MLB situations there, they still, you know, the ball came and it still got them in the face. So there's some risk there. No harm in wearing a mouth guard for sure. Safest?
Your safest sports.
Yeah, like,
Swimming.
yeah, in terms of teeth. Actually, swimming is a funny one too, because I've seen people chip their teeth in the pool. Like they dive in or something, and I don't know, they swim like this, but bang their teeth on the bottom of the pool, or wave pools, like wave pools at parks. A lot of people chip their teeth or lose their teeth from like going up in the wave and down and banging their face on the bottom. So again, like these things can happen at any point at any time. But yeah, golf, tennis, kind of like those individual sports, chess. Yeah, I consider that a sport. There's people that would smoke me at chess. Golf, tennis, chess. Yeah, pretty safe. Pretty okay. Rowing. What's that called? Crew? Yeah. Crew, you're probably okay, but I actually have seen someone take an oar to the face. So it's usually like not during this because it's so controlled, but it's like when they're cleaning up, someone like picks it up and turns and whack, hits someone behind them right in the face. So like I said, these accidents can happen at any time, and that's why it's so important to just know the steps. So we talked about if you have a broken a tooth that gets knocked out, you know. The most important thing, get that thing in some sort of solution. So the Hank solution is the best, followed by milk, followed by that person's own spit or saliva. And you just want to try to keep that tooth vital, meaning keep it alive until you can get it implanted. And that's why for a tooth that gets knocked out, I don't think ER is your best option, because sometimes you go to the ER and you'll sit there for 4 hours before you're seen, and it could be too late at that point. So I would say call your dentist. They probably have an emergency line if it's the weekend. And if you can't get a hold of them, do a Google search for oral surgeon. Oral surgeons are usually on call, and so they'll take care of you. But ER probably not the best choice for a lost tooth, because time is vital. Time is key. So get it, and then you'll get it reimplanted, and then they'll do some sort of splint where they are essentially gluing that teeth to the 5 or 6 teeth next to it to just hold it there while the bone potentially heals and recovers. But time is the most critical factor. So you want to get that thing that knocked out tooth into a solution, and then go see a provider as soon as you possibly can. So.
What about sports like snowboarding or skiing?
That would probably be a question for someone who lives more in a place with snow. I mean, in Nevada and Las Vegas, northern Nevada, we've got great mountains. Las Vegas, we got one mountain, and it's very small. I haven't ever seen a face tooth accident from snowboarding and skiing. Now, those professionals that go big or go home, I'm sure it can happen. But I think usually the way you fall, because I do love to snowboard, and I'm trying to think how I fall. It's usually like you're not leading with your face, unless you catch your front edge. But most of the time you get your hands down, so you kind of like brace yourself. And the snow is usually, hopefully it's powder and it's soft. But yeah, I haven't personally seen a lot. Actually, I haven't ever seen anything from those. Now, again, it can happen, especially if it's icy conditions and you're going on big jumps. So if you do, like, when I learned to snowboard, you were a nerd if you wore a helmet. And it was like frowned upon to wear a helmet. It was like, if you're wearing a helmet, you better be doing cool stuff. You know what I mean? Like, you better be doing like 1080s and stuff. Otherwise, you're just like a poser. That's kind of was like the mentality. But now if you look, like when I go, almost everyone has helmets on, which is great. Because I think for snowboarding and skiing, we're more worried about head trauma, head injuries, concussions, stuff like that, than actually teeth injuries. Because usually when you hit, you bang your head pretty hard. So if you're going big or going home, just make sure you're wearing a helmet. So anyways, long story short, like, I've seen crazy stuff. These ones were all sports injuries. I've seen people just like have these kind of trauma injuries at home, right? Like one guy on a ladder, I think he went to jump down. His pant got caught on a screw hanging out of the ladder, and he just like swung down and hit his face on the ladder, you know? So, trauma can happen at any point and any time. Obviously, you're not going to wear a mouth guard everywhere you go. So the key is just understanding how to most effectively treat that trauma and who you need to see in each individual situation.
So moral of the story, your teeth are never safe.
never safe. But yeah, there's people out there that can help and put you back together. So, and there's almost always a way. We should do a video on like how oral surgeons treat cancer patients that have to cut their jaws out. I mean, it's fascinating. So, but there's always a way to make you look, you know, to treat things that are unfortunately terrible that happen to people sometimes. Yeah. Okay, so speaking of oral surgeons and the good work that they do, my colleagues on the surgery side of the dental world, if you want to learn about wisdom teeth, why we take them out, when is the right time to take them out, go ahead and click here. Thank you so much for tuning in. Remember, smiles change lives, so keep smiling.